Alright, this is the lumbar spine eval practical, and I will start with MAPSO, so mechanism of injury, acute, chronic, past history, pain, signs, symptoms, sound, other. Then we'll go into standing for, stand right there, Dad. So first thing we will do, I would look for is any pelvic asymmetries, seeing if one side is higher or lower than the other. Then, over your side, like this, I would look for kyphosis or lordosis. And you can face this way again. And then also I'd look for listing, which is leaning to one way or the other. So,
It's a rock.
yeah, or it's not rocking, it's like leaning too much, like putting all your weight on one. So if someone was leaning more on their right leg or their left leg, I would observe for that. And then I'll have you take off your shirt. Turn it the other way. You'd also observe for scoliosis, and you could be able to figure that out if it was functional or a muscle imbalance by doing an Adams test. That's where you just bend over, so hands pulled. And you would look for, just a little bit. There you go. And I would look for to see if there's any uneven level of the back to see if there is some type of dysfunction, either due to a muscle balance or because of a structural problem with the spine. You can put your shirt back on. Now, I'll have you do active range of motion. So for this one, for this, I will only be doing it to one side, but obviously if there was multiple ways you could go, you would do both sides starting on the strong side, then working to the weaker side or injured side. So first thing I'll have you do is active range of motion, trunk flexion. Good. Then I'll have you do trunk extension. Good. Then I'll have you do trunk lateral flexion. Good. And I'll have you do trunk rotation. Good. All right. Now I'll have you do myotome for S1, which is plantar flexion. So just do a calf raise for me. A calf raise. Do another one. Okay. And now I will do a manual muscle test for quadratus lumborum. So that's just the hip hiker. Good. Now I will do special tests. The first one is the single leg stance test. This is testing for spondylosis or spondylolisthesis. Positive sign would be pain in the lower back. Stand behind you. And then this is where you bring your leg up. Your leg up and lean back. Good. Alright. Then there's the Trendelenburg test. This is testing for glute medius, glute med weakness. Positive sign would be the non-weight bearing leg having the pelvis be lower than the weight bearing leg. So stop like that. Good. And then the last one is the quadrant test. This is testing mainly for facet joint pathology. Can also be for dural irritation, intervertebral frame and compression, or SI joint pathology. This one, have you lean back, to the side, back, stay back, push down. Good. Positive sign for that would be pain. And the pain, depending where it is, would give you an idea of what is the problem. Now, I will have you prone. You can take your shirt off again. So for this, we will be doing palpation, and you'd always palpate for muscle spasm, pain, deformity, or pain, muscle spasm, deformity, or swelling. But you can scoot back, Dad, so your head's not hanging off. Keep the pillow underneath your waist. So there you go. All right. So first thing I'm palpating for is the spinous process. So that's right in the middle of the spine. And then there is the facet joints on either side of the spinous process. The main muscle running down here is the erector spinae. And then there's the supraspinous ligament and the interspinous ligament. The supraspinous ligament runs the whole length of the spinal cord, whereas the interspinous ligament is in between each separate vertebral column, so there's a different ligament for each one of those. It's not one long one. Then there is the iliac crest, the SI joints, the PSIS, the sacrum, the coccyx, then there's the glute max, glute med, glute min. There's the sciatic nerve, and then the ischial tuberosity. That is it for palpation. Now I will have you do the prone press up, which is just good. Now I will have you do the erector spinae progression. Yep, so just bring it up like that. Good. Now cross your arms at your chest. Good. And above your head. Good. And streamline. Good. Okay. Now we will do the manual muscle test. So this is the hamstring manual muscle test. Don't let me push you down. Good. I would hold that for 5 seconds normally, starting on the good side, then working to the bad side. Now this is the glute manual muscle test. Don't let me push you down. Good. Relax. Now we will work into the special tests. The first special test I will do is the spring test. This is testing for hyper or hypomobility of the vertebrae, possible facet joint pathology, or possible stress fracture. Positive sign would be hyper or hypomobility of the vertebrae or pain. Good. Next test I'll do is the sacral thrust test. This is testing for SI joint dysfunction. Positive test would be pain in the SI joint region. Good. Then the next one is the femoral nerve stretch test. This is testing for femoral nerve root impingement in between L2 through L4. Positive sign would be anterior or lateral thigh pain. So you bring up the knee. Just like that. Good. You would do that bilaterally, starting on the good side, working to the bad side. Now, I will have you go to your side. You can take the pillow out. The first thing I'll have him do is myotome for hip adduction. This is L2. So we'll bring it back here. Just like up. You would hold these for 5 seconds. You would also do these both sides. Just relax, man. All right. Bring this leg up. This one. And then don't let it push you down. Good. Relax. All right. This is the glute medius, glute min manual muscle test. Relax. Right there's good. Don't let it push it down. Okay. Good. Now we'll do the piriformis special test. The piriformis special test is testing for piriformis tightness. Positive sign would be pain when stretching the piriformis, or sciatica, which would indicate sciatic nerve may be running through the piriformis. So this, oh. This one. Come to the edge a little bit. That's right. Rest. Positive sign would be, positive sign would be the pain or the sciatica. Don't resist. Good. And then you can scoot more toward the middle of this again. And there's the SI joint compression test. This test is testing for SI joint dysfunction. Positive test would be pain in the SI joint. And then this test is distracting the SI joint. Good. Now I'll have you lay on your back. Good. Okay. So then I would palpate the ASIS, and then there's also the pubic symphysis. I can also check lordosis here, and then I'll have them do the rectus abdominis and oblique progression, which is very similar to the rectus spinae progression. So have your hands at your side. You look crunchy. Good. Hands over your chest. Same thing. Hands up at your head. Same thing. And streamline. Same thing. Now get onto one of your sides for me. Put your back flat. There we go. Okay. Now hand at your side. Up. Good. And here. Good. Hand above your head. Good. And then streamline. Good. Alright, and now I'll have you lay on your back more. Alright. This is the iliopsoas manual muscle test. We'll do this bilaterally normally. Don't let me push it down. Good. Alright, now for the special tests. The first one I will do is the SI compression test, SI joint compression test. This is testing for SI joint pathology. Positive sign would be pain in the SI joint. Good. And then the next one I will do is the Faber's test. This is testing for hip or SI joint pathology or iliopsoas tightness. Positive sign would be pain or not being able to, not being equally flexible on both sides. Okay, that's Faber's test, and there is the, come to the edge a little bit for me, Dan. This is the Gainsland's test. This is testing for SI joint dysfunction. Positive test would be pain in the SI joint region. Relax. Hold your legs. Go. And keep holding your left one. Let this one drop. Good. Relax. Now we will do the Lesiege's test. So I'll have you flex your leg up for me. No, straight leg raise. Straight. Sorry. Okay. Now bring it to a more comfortable spot, and then dorsiflexing the foot. Relax. Okay, that is testing for possible nerve root irritation or disc pathology. Positive sign would be pain before the end range of motion, or not being able to bring the leg all the way up. Yes, okay, and now for the Wells straight leg raise. This is testing for Wells straight leg raise is testing for occupying lesion. Positive sign would be pain in the opposite hip. So if you're raising your right leg, it'd be pain in your left side. So I'll have you raise your leg up. Good. Flex your knee. Pain. Good. Then there is the bowstring test. This is testing for nerve root irritation, and positive sign would be pain or reproduction of symptoms when palpating the sciatic nerve. So, good. Then there's the tension test. This is also testing for nerve root irritation. Positive would be tenderness with possible reproduction of neurological symptoms when palpating the sciatic nerve. So here. Good. Then there is the Koenig's test. And this is testing for disc pathology, dural irritation, or possible meningitis. And that is here. Good. And then there is the Brzezinski's test. This is also testing for nerve root irritation, dural irritation, and possible disc pathology or meningitis. So this is where you would just flex your neck. Flex your neck, just bring it up. Good. Positive test for this would be one or both legs rise off the table or pain in the lumbar spine. I don't think I said the positive for the Koenig's test. Positive for that would be pain in the lumbar spine that would possibly radiate down the legs. All right. Then there is the Hoover test. This is testing for malingering. Positive sign would be the person cannot lift their leg, and you don't feel a downward force on the opposite leg that they're not trying to raise. So, lift your leg, one of your legs up. Good. Then, over here. Then I would pretend I have a pencil in my hand. This will be the Oppenheim test. This is testing for upper motor neuron lesion. Positive sign would be great toe extension and toes splaying out. Just go down the tibia. Then there is the Babinski's test. This is testing for this upper motor neuron lesion. Positive sign would be great toe extension and toe splaying. You just go like that. Now I will do the Milgram's test. This is testing for extra or intrathecal pressure causing disc pathology. Positive sign would be patient can't lift one or either of their legs. They cannot hold this test for 30 seconds, and pain or reproduction of symptoms. So this is the one where just lift your legs 2 to 6 inches off, hold it for 30 seconds. Good. That was 30 seconds. And then finally, there's the long sitting test. This is testing for SI joint dysfunction that leads to leads to a leg length discrepancy or possible ilium rotation. So I'll have you do a glute bridge. Bring your hips up. That's good. Good. So he did a glute bridge. Alright, now let's do a sit up. Good. Positive sign would be, so if there's an anterior innominate rotation, it would be the leg goes from longer to shorter, and if there was a posterior rotation of the innominate, it would be the leg would go from shorter to longer. Alright, now move this out of the way. Sure. Yeah, that works. Alright. So now we will go to circulation. So down here you can't really see his toes, but for circulation I would check capillary refill, and then I would also check warmth and color of the skin. Make sure it's not cold or white or blue. Good. Then I would do dermatomes. So dermatomes would be L1, L2, L3, L4, L5. Lift this up for me. Like up. S1, Good. Then I will do myotomes. So L1 is hip flexion. So bring this leg up. Don't let me push it down. Would hold this for 5 seconds. Would do this on both sides. Good. Now L3 is knee extension. So extend out. Don't let me push it down. Good. Then L4 is dorsiflexion. So bring your foot up like this. Don't push it down. Good. Then great toe extension is L5. Don't let me push it down. Good. Keep that down there. And I'll go to the Achilles reflex. Good. Then the patella reflex. Good. And then I will do just keep it down there, the piriformis manual muscle test. So bring it here, don't let me push, so keep it like this, don't let me push you out of it. Good. And then we have the special test. So there's the Valsalva maneuver. This is testing for thecal or intrathecal or thecal pressure. Positive sign would be pain in the lumbar spine with the bearing force. All right. Just act like you're trying to have a bowel movement. Good. And then there is finally the slump test. This is testing for impingement of the nerve root. Impingement of the nerve root, spinal cord, or dural lining. Positive sign would be pain or reproduction of symptoms. All right, so first thing that we do, slump down and bring your neck down, then point your toe out, point toe, and then bring this forward. Good. You would do that bilaterally, and you would start on the good side, work to the bad side, and make sure I got everything. Yeah, that is it for the lumbar spine practical.